Hello, everyone, and welcome to the launch of our program, Pathways to Prosperity, Building Strong Communities for Business Success. NHBSR decided to start this program because New Hampshire is facing continued skilled workforce shortages that stifle economic growth and business success. Pathways to Prosperity is a program aimed at highlighting the synergistic benefits of businesses stepping up and taking proactive leadership in addressing critical societal issues that affect the workforce and communities around them. By leveraging their resources, influence, and innovative approaches, businesses can play a pivotal role in creating positive and sustainable change in areas such as affordable housing, childcare availability, quality education, affordable healthcare, creating inclusive, welcoming workplaces and communities, and financial sustainability for employees, thus creating the environment where businesses and communities thrive together. And we have the perfect webinar to launch our new program. And just as a side note, you don't see sponsor logos because that's an opportunity. So if your company values align with that, we welcome sponsors to reach out and get in touch with us. Next slide, please.
Sorry.
No problem. I am very happy to introduce our speakers for today. And we launch it with a very comprehensive webinar and workshop. If you can stay for the last half hour, Lindsay and Mari will be engaging in a discussion and workshop solution. The first hour, we have Lindsay Simpson, an all-around wellness champion at the individual and system level. She is responsible for planning, development, implementation, and evaluation of employee well-being initiatives for both the Richard Group clients and for internal staff. She works from a research-based, holistic perspective, respecting that every group and every individual has unique strengths and passions. I have extensive bios for each of these speakers, so we will share the link to the bios in the chat. Mari Walsh joined the Richards Group as an organizational wellness lead in 2021. She works closely with employee benefits clients to design data-driven wellness strategies. And again, the contact info and extensive bios will be shared in chat. Emily Hall Warren, we're lucky today to have Emily, the Director of Administration at WS Badger, a family-owned and family-friendly business, and a member built around healthy living in the workplace and in the community. Badger is known for its certified organic and truly natural personal care products. It employs 85 full-time and part-time workers and is a certified B Corp, which adds transparency to the company's social and environmental business practices. We also have a team member from Badger, Amanda Reed, who is here to help with some examples. For the past 5 years, Amanda has served as the Human Resource Coordinator for WS Badger Company, a family-owned, again, organic care manufacturing company. So thank you, Amanda and Emily, for providing the business example for this webinar. And I will hand it over to Mari and Lindsay.
Perfect. Thanks,
All right.
Tina.
Yeah, welcome everybody.
And open up the slides. And we can kick it off. So thank you everyone for joining us today. As our initial icebreaker, we would love to hear from you in the chat. If you want to type in the industry that you work in and a favorite employer provided benefit, could be anything like a dog-friendly office, mental health days, anything that you found particularly exciting that an employer has provided.
So as we introduce ourselves and talk a little bit more about our work and then the plan for today, we'll keep monitoring this chat. I think it's a good way for us to understand who's joining us today and what kind of perspectives you bring to our discussion. So our aim today, just in general, is, to share some very real examples and do so with a little bit of fun and a little bit of flair. We chose this goofy photo, taking care of business on purpose, to try to inspire that creative thinking. because it really does take being creative and collaborative to solve some of these really complex challenges. You heard our bios from Zena already. Mari and I thought we would also share with you just a little bit of a quirky tidbit about ourselves. I made the fun/silly mistake of asking my sister for a suggestion on this one, and she thought I should tell you the story that illustrates my curiosity in life. Once I have been known, I once, when I was a teenager, I hate to say a kid, but I swatted at a wasp, and the wasp let go of its stinger, which landed sideways in my hand. At which point I decided I wasn't sure if it actually stung me, so I picked up the stinger and stuck it in my own hand to find out. Quirky fact. There you go.
Nice. And my fun fact is that I'm a huge fan of pull-through parking. I don't think that there's anything better than going to the grocery store and not having to reverse through the whole parking process.
So I'm looking at the chat here. We see some state government folks, arts, nonprofit, paid family leave is a great benefit that you're enjoying. Volunteer paid time off. I think, what is that? Valentina. Hopefully I pronounced your name correctly. Flexible personal days. Seeing a lot of tuition reimbursement. So we're going to talk about some of these types of examples and expansions of those ideas today.
Mm-hmm.
What we're going to do though first is sort of set up those and look at what are the needs of both employees and employers right now in the workforce in New Hampshire. We're again thrilled to have Emily and Amanda here from WS Badger to talk about how they've solved some of these challenges right here in the state. And then we've planned a breakout session. So lots to get through today. We're excited about it.
Yeah.
Mari's going to kick us off though by really kind of outlining some of the case for the problem, but please feel free to write in the chat as we're talking about your experience with these kind of challenges. Okay.
Mm-hmm.
Go ahead, Mari.
Yeah, so we're going to start from the employee perspective, and we're going to really focus on the basic needs of employees and some of the challenges that arise, particularly for lower income earners when it comes to addressing those basic needs. So we're going to kick it off with financial stability. And this is really key to all of the employee challenges that we're going to talk about today. The more financial stability that an individual has, the more of a buffer that they have against the daily stresses that can be caused by these basic needs. And there's a few specific variables in New Hampshire that can really impact an employee's ability to achieve financial stability. So one of those is a particularly high cost of living. And we've taken a lot of New Hampshire specific dollar amounts and worked them into this section. So hopefully we'll do a good job of painting the picture of how costly it can be to live in New Hampshire. We also know that as a state, New Hampshire has a very low minimum wage. So it's been stuck at $7.25 per hour since 2009. And we'll see throughout this presentation that many folks are making significantly more than that minimum wage, but still it can be very difficult with the increasing cost of housing and childcare to make ends meet, even if you're making more than minimum wage. And then finally, we have to mention savings when we're thinking about setting employees up for financial stability. Regardless of income, we know a lot of people are not great at managing their money and planning for the future and having an emergency fund for those unexpected costs. 70% of employees reported that they would be really worried about covering even 1 month of living expenses if they were to lose their job. And that gives us a really good idea of how many folks are living with a really thin cushion when it comes to their finances. So I mentioned that many employees are actually making significantly more than minimum wage, and we can see that in the table on this slide. So we're looking at the top 10 occupations in New Hampshire, and those are in the first column. And then we see the estimated number of employees that were in those occupations based on 2022 data. And then in the far right column, we have the average wage earned by the workers that were in those roles. And if we look at those wages, we can see that there's a pretty big range. So in the second most popular occupation of cashiers, the average wage was $13.44 per hour. In the high end, we had the third most popular occupation, which was general and operations managers, and they were making a little over $60 per hour. That wage is really a great outlier in this list of the top 10. And for a majority of these, we see that the average wage earned was less than $22 per hour. So to help put that into context and help us understand who can cover their basic needs with $22 per hour and still remain self-sufficient, we've pulled in data from MIT's Living Wage Calculator. And this is a really interesting tool. It's available online and free. And they have data for every state. And you can also drill down by the county level. So the table that we're looking at on this slide is specific to the state of New Hampshire. And we're looking at the estimated living wage based on the individual situation. So how many folks they have in their household, if they have 1 or 2 adults, how many folks are working, and if they have between 0 to 3 children. So looking at that living wage row, again, we can see that the need really varies depending upon what someone's household looks like and how many adults and kids they have. But for most of these, it does take an average wage of more than $22 per hour to be able to comfortably meet the needs of the household. Moving into housing, so we know that housing is a huge challenge for employees, and we've really seen significant increases in home prices in a very short period of time. So this table comes from the 2023 New Hampshire Statewide Housing Needs Assessment, and it shows the jump in home prices between 2019 and 2022. And when we look at the first row for New Hampshire in total as a state, that average home sale price jumped 50%. 50% in just a little over 3 years. So with that shift in housing prices, we've seen a lot of people pivot away from being in the home buying market and renting instead, which has led to a really low vacancy rate for rentals and increased the price for those rentals. So unfortunately, we've seen that for lower income folks, it's becoming even more challenging to find an affordable place to live in New Hampshire. And with that, we want to pull up our first poll and hear from the audience today. As an employer, do you feel like the New Hampshire housing market has had an impact on your ability to attract and retain employees to work for your organization?
Debbie, are you able to pull the poll, the housing one, please?
Okay, see some initial responses coming in. Just leave it up for a few more moments.
I'm curious, after we do this poll, if anybody wants to unmute and share a little bit about how that challenge is impacting your business. Can you maybe tell us a bit of an anecdote?
I have overheard anecdotes from childcare centers in the Monadnock region. They found people and they agreed to come work, and due to housing, they withdrew and went back to Massachusetts. They could not fulfill. That the spouse was even registering at a school and withdrew because of lack of housing. So it's that difficult.
So I'm going to go ahead and end the poll so folks can see the results. So we didn't have anyone report that it wasn't a problem. It looks like the most popular response was that it's pretty limited, but it does come up. But so far organizations have been able to problem solve. Actually, is that tied? No, close second was moderate in some cases. This has been a significant challenge. And then we had one very significant.
Again, if anyone who's participating, feel free to unmute yourself and share a little bit about how that's impacting your business or changed your duties for hiring. No comments? You could also write it in the chat if you want. We're looking at that.
Okay. We'll keep monitoring the chat and keep it rolling. So childcare is next. And at the Richards Group, we work with a lot of different employers, and we've been having more and more conversations about how to support the childcare needs of employees. And I think this is one that comes top of mind because it really touches any working parent. It's incredibly difficult and stressful to juggle the demands of work life and then also taking care of your family needs, particularly if you have young kids who are not yet in the formal school system. And there's really two pain points here for particularly new parents. So one, access, being able to even find a spot in a daycare center for a new child can be incredibly difficult. I've heard multiple people share that they started calling even before they conceived to try to reserve a spot. And then cost is obviously a significant challenge as well. So to put that into perspective, this graph shows the estimated percentage of a household's income that would need to go towards covering their childcare costs. And on the far right-hand side, we have a single female-headed household making a median income with just one toddler in center-based care. 33% of this household's income would be going towards those childcare expenses. To put that into perspective, it's generally recommended that to have quote unquote affordable housing, you should be spending less than 30% of your income on your housing expenses. That helps illuminate what a big chunk that 33% is. And then in the blue bar, if this household had one infant and one toddler, that percentage goes up to 68, which obviously is going to be a really difficult situation and not really a feasible option for anyone. Healthcare. So this is near and dear to Lindsay and myself because we do work in the healthcare industry. And we recognize this is a significant challenge both for employers and employees. So this is going to come up in the employer challenges section as well. But when we look at it from the employee perspective, even though employers typically contribute a significant subsidy towards the employee's medical insurance, when we look at these average monthly employee paid premiums, we can see that these dollar amounts are still significant and can be a real financial burden for families. So if we look at that family tier coverage, that would be coverage for 2 adults and at least 1 child. The average cost in 2023 in New England was $876. Keeping in mind that cost is just to have the insurance in place. That doesn't include your deductible, your copays, any co-insurance. So we've recently done some surveys with a manufacturing client who we've noticed has really low utilization of some of their medical benefits, but then is having folks end up on that high cost claimant list. And the number one reason that folks reported that they were avoiding seeking care is because they were concerned about those out-of-pocket expenses. So it's really disheartening to think that people could potentially be paying to have medical insurance in place, but that they're only really planning to use it if they have a catastrophic event because they're so concerned about the financial piece of it. And then transportation. So keeping a job is pretty reliant on being able to get to work and get there reliably. And we know in New Hampshire, unlike being in a big city, it's difficult to walk to work, especially if you're in a more rural community, and there's not a lot of access to public transportation. We also know that the average cost of earning a car in New Hampshire, this was really eye-opening to me, over $7,000 per year. So that breaks down to $612 per month. And as we've talked about, a lot of employees do not have much of an emergency fund to cover unexpected costs. So for someone living, a fair distance away from work, if they have a car breakdown and they're not able to immediately repair the car because they don't have the funds, that can jeopardize their ability to keep that job. And then our last employee challenge is food security. So having consistent access to food is absolutely critical to an individual's health and their ability to maintain employment. And sadly, like so many of the other employee challenges that we've talked about, this really is disproportionately a burden on low wage workers, as well as single parent households and homes with young children. And I'm sure many of us have experienced going to the grocery store and realizing that our regular bill is a little bit higher than what we are used to. I feel like every week that I go, it ratchets up a little bit more. So on the right-hand side, you can see the average price of different food items and how that changed from 21 to 22. And thinking about this from the employee perspective, if you're a higher income earner, it's pretty easy to absorb these costs and not change your lifestyle. But if you don't have much of a financial margin in your budget, these can be life-changing price changes that really impact your ability to provide for your family, and also probably means that you're relying more on processed, cheaper foods to get by instead of choosing more nutritious options. So just a couple examples to put these costs into perspective. Here we have a family of 4, and this family is above average wage earners. So they make almost $140,000 per year. When we break that down to their monthly take home, it's just over $8,500. And then we take out their regular reoccurring expenses. So they have a family healthcare premium, they have 2 young children in childcare, their rent, they each have a car to get to work. They started resuming their student loan payments, which are coming back and putting a lot of extra financial stress on employees. And then they have a really modest food budget of $600, leaving them with just over $1,100 at the end of the month. And I think really the takeaway message here is it would be easy to look at this family and see that they make almost $140,000 per year and think, hey, that's a pretty comfortable salary. But in reality, it takes a lot of diligence to make their budget work. And we haven't accounted for a lot of regular expenses in here, things like cell phone, internet, contributing towards retirement. So safe to say that, there's not a whole lot of extra to work with here. And then in our second example, we have a single mom who brings home just over $2,800. We've got her healthcare premium. She has 1 young daughter who's in childcare. She was able to find subsidized housing, so that's really helping her there. And then she's really cutting her costs with food at just $300 per month, leaving her with just over $100. And again, there's a lot of expenses we haven't accounted for here. You may notice she doesn't have a car in this situation, so she's saving some costs there. And I will share a story that in preparing for this discussion today, Lindsay and I tried to research if this mother would qualify for subsidized childcare based on her income. And we were trying to decipher the jargon and figure out the math equations. And I like to think that we're pretty adept at figuring things out. We could not determine if she would qualify or not. So as employers, I think there's a real role to play in helping connect employees, not just to resources within your organization, but also community, state, and national resources and funding that folks may have access to, but are having a hard time understanding how to take advantage of.
I think what I want to say about that is we're not in any way suggesting that HR folks need to be the only resource available. But again, it takes sort of that creative thinking and community collaboration to be able to bring other resources in that would help an individual make an assessment and find out what else is available to them in the community. So again, we'll talk in a bit more detail about those kinds of examples, but wanted to make sure that we send the message around collaboration and connecting with others in the community.
Thank you, Linz.
Yeah.
So we have our second poll. So we would like to know which of the following programs or supports you think would be most beneficial for the employees at your workplace. So we'll open that up for a few moments. Got responses coming in. Okay, last call. If you want to respond, we'll wait just one more moment before sharing. Okay. Oh, we have some latecomers. Okay, we have a clear winner. I'm going to end the poll and share. So it looks like, for the most part, healthcare plans with low out-of-pocket costs was number one. And then tied for second, we had financial planning and education and childcare or dependent care support. And then in third or fourth, you considered the tie for second is housing assistance programs.
This is really interesting feedback for us. So again, we work for the Richards Group. We're a benefits advisory company that supports groups in New Hampshire and Vermont. So for us to see that kind of feedback, that the participants today feel it's really important to have those healthcare plans with a low out-of-pocket costs, that's really helpful for us to know when we're then consulting with our HR partners around how to structure plans and how to provide a package of benefits that help reduce those out-of-pocket costs for individuals. It's such a difficult dance. So thank you for this feedback. That's really eye-opening and helpful for us to see.
Yeah. Okay, I'm going to pass it over to Lindsay to talk about the employer challenges.
Yeah, so a good segue here. Again, Mari was talking really from the employee perspective, but we know this is, you don't have employees without employers. So we want to acknowledge, first of all, that many of you have been trying to manage through a real workforce shortage. So looking at some of those statistics behind that sense, why it's hard to get applicants, why it's hard to get people to the door for interviews, and then all the way through that process, not only hiring, but then staying. We've heard from a couple of groups that they might hire someone, but they don't stay on very long because they might get another offer for even just a dollar or more per hour. And it's enough for that individual to say, okay, I'm gonna leave this job that I barely just started at and go somewhere else. So the unemployment rate in March in New Hampshire was only 2.2%, leaving just over 16,000 people who were unemployed. That pool of applicants was really small. Median age is 43 years, but 19% of that population is 65 plus. So as we look to hire or retain our more experienced workers, that's wonderful because they bring such a longevity to the role and wisdom and knowledge base, which is great for training and bringing along new employees. It also brings, unfortunately, higher liability for costs in the healthcare realm, right? We know the longer we live, the more likely we are to have complicated and expensive medical problems. So it's a real conundrum for a lot of us in the hiring space. Couple other things that stick out for us here. Very limited funding for higher education in New Hampshire as compared with the rest of the country, which contributes, as you know, to what we sometimes call that brain drain. So students leaving the state to go to get higher education elsewhere, and then we risk losing them and they don't come back to work in New Hampshire. Like I said earlier, if we have that turnover, we're looking at pretty high costs for that replacement. Generally, we factor that in at 6 to 9 months worth of salary. It's all those costs wrapped up in promoting those job positions, the time and energy spent in interviewing and training, all of that goes into looking at that. And then, of course, no question, with all of the factors that Mari outlined just previously, individuals coming to work are really asking for higher wages. I'm sure you've experienced that, and finding it hard to have those negotiations with employees, understanding all of the drivers of your bottom line as a business. Again, feel free to add some comments in the chat. We're looking at that as we go here. We want this to be, lively discussion, interactive. So looking at healthcare, one of the ways that we are able to bring value to our clients at the Richards Group is by being a member of a nationwide collaborative of other small owned privately held benefits advisory firms. And so with that, we have access to a database across the country, allowing us to analyze the costs of healthcare. So that's where a lot of these data are coming from. We know the median increase in healthcare plan costs in 2023 were 6%. We can tell you firsthand that we're seeing renewal rates come in often much higher than that for 2024. So these are real increases in costs that our clients are facing right now. And just to get underneath that a little bit, we know some of those drivers are certainly that costs went up as a result of delayed care during the COVID-19 pandemic and really shut down. A lot of people avoided care during that period, but those problems, those medical challenges didn't go away. In a lot of cases, unfortunately, they became worse or more severe or more costly to treat. One of the things that we're spending a lot of time with clients on right now is encouraging individuals to get the primary care they need and the preventive care they need so that we can catch cancers, for example, at an earlier stage, a more treatable stage, that A, is obviously better for the individual and their family, but also less costly for everyone who's involved, less time out of work, for example, for that treatment. So really, really important strategy from a healthcare perspective at the employer level, not only to provide the healthcare, but promote the primary care and preventive care that's so important. In 2022, the average annual cost for employees to provide healthcare was over $13,000, which is much higher than the national average, about $1,400 higher. So really some eye-opening data here that make the not just the case, but really make the reality more salient for us. So third poll now, we're curious how decisions, many of you are probably looking at renewals in January. How are these decisions about healthcare impacting your business right now? And this is a select all that apply, not just a choose one answer poll. So one respondent there saying they're not an employer. Okay, here come those responses. Thank you. I'll give a few more minutes as we wait for those to come in. Really appreciate this participation. It's great. Got a total of 13 responses now. Are there anyone else listening? Is there anyone else that can add your perspective so we can see? All right. Last call. Okay, I'm going to end the poll, or maybe Mari, you can do that. And we'll share those results. So total of 14 responses right now. Looks like the most popular one was, we may increase the employees' cost share. So it's hard to do, right? In an environment where folks have limited resources, but a reality. I mean, we can't ask employers to shoulder that increasing cost forever or all of it. So as you start to publish those costs for maybe your 2024 plans, that's going to be a harder conversation to have to share. Please know that if you need some data to be able to make the case for that to employees directly, that's something that we can help with here at the Richards Group. Okay. So this is the point where we want to go ahead and start talking about how do we solve these problems? What are some innovations out there? And we wanted to prioritize our time with Emily and Amanda from WS Badger. They're going to talk us through some examples. And again, we want this to be really helpful for you. So please enter questions in the chat. We'll monitor that and invite you to ask questions and have a discussion as we go. So Emily, we'll turn it over to you right now.
Thanks, Lindsay, and thanks, Mari. It's a pleasure to be here. And I'm seeing some familiar faces, so hello out there. I also have my coworker Amanda on the phone, and she is as much of an expert on all of these things as I am. So Amanda, if I say something wrong or you have something to add, please jump in. So I work for the Badger Balm Company. We're located just outside of Keene, New Hampshire, and we make natural and organic body care products. So you may have seen our sunscreen or our lip balms or our hand balms in your co-op or your Whole Foods store around you. We are a mission-driven, family-owned B Corp, and a benefit corporation is a company that has built into its DNA through its business practices a commitment to a triple bottom line, meaning people, planet, and profit, not just profit as so many traditional businesses are. We have about 85 employees. give or take, depending on any given month. And we were honored in 2022 to win the New Hampshire Outstanding Worksite Wellness Award. So thank you. So when we think about benefits for our employees, we think about a lot of these categories that Lindsay and Mari mentioned, and we try to wrap supports around our employees in addition to traditional plans, benefit plans like health insurance, EAP, et cetera, 401k. And a lot of the benefits that we offer are driven by what we hear from our employee base their needs are. So in trying to respond to the needs of our employees. And I can see through the chat that a lot of your organizations are doing that already as well, and that there's a lot of unique ideas that are out there. So I just want to offer these as examples of things that we're doing, and we can network and share more, because I always get good ideas from other organizations. So one of the things that we do around childcare and children have always been a priority for Badger. One of our co-founders has a background in education, so really focused on children. And one of the things that we have been able to do is set up what we call a dependent care reimbursement fund. This is a fund, as you can tell by the name, that is geared towards helping families pay for the times of year where even if they have kids in school or kids in childcare, they might not have coverage. So, you know, if you have school-age children, that there are weeks and weeks where the kids are on vacation or out for the summer, et cetera, and you are required to find hopefully another high-quality care situation. So in this fund, what we do is reimburse families for up to $800 per child for weeks of camp when school is closed, or other types of childcare. It is a taxable benefit, so it comes directly into the top line of their, their income, and they pay taxes on it. And we have found it to be really beneficial, because while $800 may not feel like a lot to the organization per child, it makes a significant difference in family's income. We also offer, as many organizations do, a dependent care FSA, allowing people to withhold money to pay for childcare, qualified childcare pre-tax, which can be quite a savings, depending on how many children you have and how much you're paying. We have a paid parental leave policy. So this is paid time off around the birth or adoption of a new baby in a family. Both for the way we have it set up is for a primary and a secondary caregiver. So whoever the primary caregiver is receives 5 weeks of paid time off, and a secondary caregiver receives 2. We have a babies at work policy, which is a lot of fun. And I think I just saw Amanda said today that we are on maybe our 27th baby at work.
Yes, soon to be 28th. Next month, we'll welcome our 28th baby into the office.
And so this policy looks like allowing primary caregivers, after they have had their maternity or parental leave, to bring their baby into work for about 3 months, or until the baby is 6 months old. It benefits bonding with parents. It benefits breastfeeding for moms who continue to breastfeed. It benefits women returning to work after giving birth to children, and it benefits everyone else in the organization, because we get to see babies all the time. We have a really cute one here smiling away. And then finally, I would say it is often overlooked, but particularly in the manufacturing environment, flexible scheduling can be an incredible benefit that costs very little for the employer, but makes all the difference for parents. So allowing them to get to childcare pickups and drop-offs, allowing them to go to health appointments with their kids, allowing them to watch after-school sports, et cetera. And really what it requires is flexible thinking on the part of team leaders and creativity and problem solving to make that work for everyone on the team. In terms of healthcare, we do offer the full range of employee benefits, including an EAP, your traditional benefits, vision, dental, etc. In terms of more unique policies, we offer a free organic lunch for all our employees on site. We have chefs who cook for us. It's really, we're super spoiled, and we pay our employees that lunch period as well. We find a huge benefit in terms of culture building to have everyone sitting together and eating and connecting, not necessarily around work, but about what's going on, and it's a real community building event. Our wellness fund, again, a taxable benefit. This was originally designed to pay for healthcare that may not be covered by traditional health insurance. So think massage or acupuncture, things that, or exercise equipment, gym membership, etc. We have, in the last couple of years, Mari and Lindsay really demonstrated how costs have increased. So partially in response to that, we have also widened the range of the things that people can use wellness fund money on, which to include things like utilities, so gas, if they need gas for heating in the winter, and food as well. And so it's a reimbursement plan. People have $800 or $1,000 at this point a year, bring in receipts, and we reimburse on a taxable basis into their paycheck. It's really a valued benefit to our employees. And again, as an employer, when you think about budgeting, saying $1,000 per employee is a really dollar limited amount that's easy to budget for, but makes a significant difference on the employee in their day-to-day lives. We are also, thanks to Amanda, lucky enough to have on-site yoga. We have a massage therapy company that comes in once a week, employee paid, but we make it available for them on site. We have a gym here at Badger, outdoor walking trails, and we have a lending library, which was the idea of an employee and is a totally employee organized and run. So I'm actually, I don't know if you can see.
Oh, yeah.
So on the bulletin board, there's little suggestions from employees, books they've read that they really liked. Amanda, anything to add?
No, thank you, Emily. I think you nailed it.
Emily, we have a question in the chat from someone who's curious, just thinking back to the childcare piece, how the babies at work would function for a frontline worker. No doubt you have frontline workers in production, right?
Yeah.
How does that support their childcare needs?
So I think when we originally started this program, we hadn't problem solved that yet. So we said, this is an opportunity. It's not necessarily guaranteed to anyone, but as we've lived into the program, we have gotten more and more creative, and we haven't really, I don't think we've ever denied anyone the right to do this, regardless of what their job is. So what we do is find a office with a door, and then we modify what the employee is doing. So if we have a shipping employee, perhaps we're bringing packaging materials up to that office, and they're doing packaging of materials in this space for those couple of months. And I would challenge you to think about the fact that under, for example, short-term disability, when people return from a disability, you often are required as an HR professional to make an accommodation for them. This is a very similar concept to that. We are willing to make a 3-month accommodation for a frontline employee in order to have them have the same rights to participate in this program as anyone else. And again, 3 months in the work world, is not that significant, but it makes a huge difference for a family and a child.
It's really important, I think, to have that detailed perspective of what you're doing. Thank you.
Yeah, sure.
Okay, Amanda,
Emily,
maybe
one more question from the chat.
Sure.
Someone was curious, the company that you use for the DCFSA.
Amanda, that's all you.
Yeah, we use our healthcare provider through the Richards Group, HPI. They do our insurance and our FSAs.
Great, thank you.
Okay, so when we think about financial stability, food security, transportation, and housing, we offer a paid FMLA program. This is not the state program. We put this in place prior to the establishment of the state insurance program for FMLA. But I think either approach is really helpful for employees. So if someone's out on leave caring for themselves, you know, we know that healthcare costs and catastrophic healthcare costs can bankrupt people pretty darn fast, but being able to have paid time to care for yourself and for others makes a difference. We offer employees microloans. So if an employee has an unexpected cost come up, they can come to us in the HR department, and we will offer interest-free loans that are paid back through payroll deduction from the organization. We often see employees using these for an unexpected car repair or unexpected, you know, heater, water boiler, whatever breaks in people's houses that they don't expect to come up. We do have on-site planning consultations and challenges. So we have our 401k advisor come in and do one-on-one consultations, but also provide information and do seminars on budgeting, on saving for retirement, etc. And for those of our employees who are working in the manufacturing environment, we do offer footwear and clothing reimbursements. Our products are oil-based, so any little spill ends up with a stain, and so we want people to be able to help them with having work clothing that they can get messy. And finally, we offer pro deals and bulk ordering. So through our kitchen, because we're already purchasing in bulk for food production for our kitchen, we can extend those offers to employees for ordering you know, staple food ingredients. On site, we have a garden, and that is a portion of which is maintained sort of by the organization, and a portion of which employees can choose to have a lot, so they can be growing their own food for their home and maintaining and helping take care of this larger community garden. And the food that we glean from there goes to the community kitchen in Keene, which is a food pantry and also does prepared meals. So that feels really great. And I realized when you were talking earlier, Lindsay, that we didn't add onto here one thing, which is we do have a $15.75 starting wage. So we are actively working on increasing our starting wage to be more comparable to what we think a family living wage is, but we do have a commitment to start at a certain level as well.
Thank you, Emily.
Yeah.
Jennifer added something in the chat that you said you have a similar program for auto repair loans, an auto shop for employees to save.
Oh,
those are some really interesting creative solutions. Jennifer, I just want to invite you to unmute yourself if you want to tell us more about that.
Yeah, can you hear me?
Yeah.
Yeah, so this just started this last year. It's a similar interest-free payroll deducted loan up to $1,000. And the auto shop is actually part of our organization. And they treat our employees. I've taken my car there. They saved me from getting essentially ripped off, for lack of a better term, at another place. And yeah, we all also save 20% there on our repairs.
So again, just a really creative example. Thank you.
Lindsay, I'm curious if I can ask Emily about the turnover rate for their employees. When you hire someone, do you notice that they stay with all these benefits that you provide? What are the trends that you're seeing?
thank you for that question. I think I'm on with a bunch of HR professionals, so I'm going to be totally transparent. Historically, our turnover rate has been like so minimal. It's been like I used to be able to just pop a new job up on our website and we would get a bazillion applications. It was like hiring and recruiting was a non-issue. I will say that the post-COVID churn that we saw in the employment market affected us just like any other organization. So the last couple of years, our turnover rate has gone up. I believe it's due to, extenuating circumstances, but we have to ride that out to make sure.
Thank you.
Mm-hmm. Appreciate the generosity and the honesty there, Emily. I think that's what makes stronger communities, right?
Yeah.
Okay, thank you. So we want to continue this discussion and share some other examples from other clients that we work with. So looking at Chroma Technology, they're just over the border in Vermont in Bellows Falls, but really well known. They have an extremely generous medical care plan where there's zero premium and zero deductible for employees to participate in that benefit. They also have some really unique opportunities for employees. They provide an on-site nurse health coach who can do one-on-one work with those individuals, not only to manage kind of day-to-day illnesses or sicknesses. For the most part, we hope that folks are not coming to work with those illnesses. Obviously, COVID really changed our cultures in the workplace around that. But that nurse health coach is available to work on goals with those individuals. So let's say, for example, they have a new diagnosis of hypertension. The health coach can help them figure out how to kind of reconfigure some health behaviors and choices in their life to better manage the chronic condition that they're living with. Really, so a valuable resource, especially in an environment where we hear a lot from clients that employees have a hard time accessing healthcare. There are fewer and fewer primary care providers with openings in their practices to take on new patients, or it takes a long time to get in for an appointment, and there's a lot of waiting period. Unfortunately, that tends to kick up higher costs for the individual and the organization if that person then has to go to urgent care, or even worse, go to emergency room to deal with something that could generally otherwise be cared for at the primary care level. So other resources at this particular provider, they have also an on-site life resource coordinator. Many of our clients have employee assistance programs or EAP through a group called Invest EAP. Invest EAP, in the part of their contract with Chroma, has an on-site person who then develops relationships with individuals and can help those folks kind of solve those life resource needs. It might be, again, let's say it's a car repair need or a elder care need. A lot of individuals in our workforce, the sandwich generation, as we call it, are not only caring for childcare for children, but they're maybe also then managing elder care in their family systems. So that resource coordinator is on site to develop those relationships outside of the HR relationship, which provides some social safety and sort of emotional distance for the employees to then solve some of those other challenges. So a really valuable resource that gets well used in that workplace. They have a committee of folks who manage a wellness fund and provide other benefits like massage on site. They host a health and wellness fair with a biometric screening. That screening, by the way, is provided by the on-site nurse health coach. So that nurse health coach has the data to then connect with individuals about their very personal health conditions. They have an on-site fitness space, and then a lot of other pieces around the year, like a wellness reimbursement fund, such as Emily described already. And then the other big thing that they've invested in is training individuals across the organization in mental health first aid certification. So like first aid or CPR, that's a structured curriculum and certification process for individuals in the workplace to be able to recognize when somebody's having a significant mental health event and know the skills to kind of intervene as a supportive peer and then help that individual connect with resources. So they're not providing the mental health support directly that would otherwise be provided by a trained professional mental health provider, but they're trained to intervene or notice and then respond in a way that helps provide and develop a culture of caring and promoting that idea that recovery for mental health conditions is actually possible, and normalizing that. So it's a really beautiful way to address what we're seeing as increased mental health needs in the workplace as well.
And
Lots
Liz,
of, Mhm.
sorry, I didn't mean to cut you off. I'll just add on the mental health first aid certification. The UNH extension program offers ongoing free virtual mental health first aid trainings. So we've had some employers, pick leaders from within the organization that they want to send to those trainings. We also have a network of facilitators in New Hampshire. So if anyone's interested in coordinating a private mental health first aid training for your employees, that's something that we can help with as well.
Mari, I just want to add that the Richards Group, Shannon Prescott, is actually offering free mental health first aid training to NHBSR members on October 27th, and the registration is open. If you want to sign up or sign up any of your managers, we have spots. We still have 24 spots available, and she volunteers and offers it for free to our members. So that's a great benefit.
Awesome. Thank you, Zena.
Thank you. Yeah. So let's look at a couple of other examples in the childcare space. I'm sure some of you know New London Hospital. It's a relatively small rural hospital. There's 550 employees there in New London. They're really well known, in fact. So this might not be news to you. They have an on-site childcare provider that's available to their employees exclusively. So this is a way that they've solved that childcare problem, which is especially tricky in a healthcare setting where people are working long or different kinds of hours from the typical kind of 9 to 5 workday. So this is a state licensed childcare center that serves babies 6 weeks to age 5 years. They've been doing this, as you can see, for a really long time, and it's very, very successful. So it's a kind of creative thinking that has really helped New London attract healthcare providers and workers for their system. The other benefits here are that the childcare workers are employees of the hospital. So we know that one of the challenges in the childcare space is that those childcare workers are typically paid a relatively low wage, and yet they're carrying the cost of education and training required to be in that role. They often are not able to access other kinds of rich benefits that are afforded when you work for a larger organization like a hospital. So this is a way for them to attract high quality childcare providers and retain those providers, which is another layer of complication when it comes to the childcare industry in general. So minimum pay there at $17 an hour, which goes up from there. And, while this might not be something that's a solution that's available to you as an employer, I urge you to think about being creative and connecting with those childcare providers in your community. Maybe there's a way to partner with a couple of other companies in the area, employers in the area, to support that childcare center in staying open. Maybe it's about securing spots on behalf of your employees. So thinking, again, really creatively to solve that childcare problem and keep those childcare centers afloat. Okay. Again, please add your comments or questions in the chat as we go. Financial security, Mascoma Bank, another one of our valued clients with a headquarters in New Hampshire and Lebanon. They offer a number of resources available. They're also a B Corp, just like WS Badger. So they have things like that 401k contribution, a number of different savings accounts, FSA, HSA, DCA accounts. They also have a lifestyle spending account that they just put in place this past year. That's new for them. So that allows employees to use $300 a year to pay for things like a Netflix account or other kinds of lifestyle enhancements that they might otherwise put by the wayside when they're prioritizing funds for other things. They have a wellness benefit up to $150 a year. discounts and perks with other local businesses. So this is a nice way that they've leveraged local relationships to be able to provide employees with discounts to, purchase clothing, for example, or heating oil for their home. They have student loan reimbursements and loan discounted home loans available to help getting into home ownership a little easier for employees. And then they have a really strong value on environmental reducing carbon emissions. So they have low interest loans for things like purchasing electric vehicle or putting in a heat pump, for example, insulating the home. So those higher cost improvements that actually reduce the carbon foot for the global economy. So a couple other things you see in there. They also have a really fun charitable donation match that allows that giving in the community again, and paying it forward, spreading the wealth. So moving on, we're looking at food security now. This can be a really tricky one, right? We've talked about this in a number of ways today. How do we ensure that individuals are getting nutritious, high quality foods that promote their health? We know when we start to have to really limit the spend on food in our household budgets, we tend to buy cheaper, less nutritious, less nutrient dense foods, which can lead to other diseases. So when an employer is able to invest in providing food security for employees, that can be a really valuable, more far-reaching benefit than you might think about on the surface. So North Country Smokehouse in Claremont has a healthy breakfast and snack program that they do right there in their break room. They have fridge space and a full kitchen so that people can bring lunch to work, cook that on site, and have healthy options available. But we also know of other groups, for example, that have started food pantries on site or are partnering with a local food donation system to be able to make those foods accessible for those who are stretching their dollars. In addition, you can see some other benefits there for a wellness reimbursement fund, medical benefits, and an HRA card of up to $500, again, to cushion the costs of the medical spend should they need it. Okay, Mari, is there anything you want to add because I'm working with them?
Yeah, absolutely. So we have some groups in New Hampshire who have taken advantage of Cheshire Medical Center's Well-Powered Worksites program. So that is region specific. You do need to be in the Monadnock region to qualify. But as part of that program, they offer $500 mini grants to employers for health and wellness initiatives. And we've had groups apply and use those funds to offer mini on-site food pantries for employees. So there's a lot of different things you can do. Another thing to be mindful of, a lot of the medical carriers may provide wellness funds, and sometimes those can go undetected and be unknown. So if you are fully insured with Cigna or Blue Cross, definitely worth asking about if there's any opportunity to have some funds from the medical carrier to back up some of these initiatives.
Mari, I'm just wondering, as I go on and talk about the last example on housing, can you pop into the chat the Well-Powered Worksites link for those who might be in that county?
Yes.
Thanks. Okay, so housing, we've talked about a number of times throughout the day today, the time together. And this is where we see some really creative work happening. Employers coming together and creating funds. So you may have read about this in the Upper Valley of New Hampshire, the Dartmouth region. We have a number of groups who've come together to develop a significant fund that is designed to be sustained long-term, but kick off low interest loans to build housing in that area that would then benefit the local community. So really some wonderful names here: Mascoma Bank, Hanover Co-op, Citizens Bank, King Arthur Baking, have all donated funds to get this started. And you know, I don't know the ins and outs and all of the details here, but it is that fund is managed by another local organization and allows them to leverage and then be eligible for other grants or federal programs. So it's not just about those funds that are donated in but it's about using that to then be able to attract more money into that fund, and make these really big goals for building. So right now, the
If I
short-term goal is,
may,
Mhm.
it's actually, we are featuring that model in November in a webinar, and the CEO of Mascoma is one of the speakers, and it's
Not
lending
surprised.
at Evernorth, the VP of lending at Evernorth, the organization in charge of lending, and the Hanover Co-op stores, Alan Reitz, is coming as well, and they're going to be open for questions. So if you have questions on the details, how they did it, how they overcame challenges, our November webinar will cover this specific project.
In much more detail, right? Yeah. So they have some great goals here. They're on track to build 260 apartments by 2025. And but it's a shortfall from this goal. They know they need far more than that in the coming kind of 5 to 10 year range. Emily let us know that there's a similar program happening in that region through, Emily, do you want to comment on that just for a moment? The funding partnership in your area
Yeah,
for housing?
I don't think it's off the ground yet. It's just, there's a couple of the Monadnock Interfaith Coalition is beginning to work with organizations to try to get this up and running.
So again, that's the kind of creative solution. So this is the part here where we're going to shift into some opportunity for smaller group discussion. So Zena is going to help break folks out into smaller breakout rooms. I think it's going to be, 4 or 3 to 5 people in a room. Your task, as we're assigning to you, is to move into that breakout room and then pick one of the kind of challenge areas to focus on in your discussion, whether it's financial stability, housing security, healthcare, childcare, transportation, or food security. And then we really want you to have the opportunity to share successful solutions that you've implemented in your workspace or you've heard elsewhere in the community, and just give you a chance to kind of dig into this into more detail. Ask those questions like we heard earlier. How does the Babies at Work program, for example, function for frontline workers? Okay, so I'm just going to look at my clock. We are scheduled to be together until 1:30. I see now 1:07. So we'll
So
give
if we
10
minutes, yeah,
10 minutes for this, and then we'll call folks back to join. Okay.
great. So I opened all the rooms, and you have a link in the chat to open a document that you can keep up with the question, or it's in your chat right now. So you could go ahead and join our breakout rooms. And we have I will stop the recording because or pause for your time. I want to share a few upcoming events for us. I've been sharing them throughout, but I want to mention them one more time. And let's see, we have a series of webinars that cover these topics, and the next webinar coming up for us will be in October 11th. At noon, and it will be similar to this, offering a half-hour workshop afterwards with the Good Job Institute. The Good Job Institute is a nonprofit offshoot headed by the MIT Sloan professor Zainab Tan, and their director Amanda Silver is joining us with a business case example. Moe's Barbecue in Portland and Bangor was having a really hard time with attracting and retaining employees, and they come in and they help small businesses. They actually have pro bono services for smaller businesses, but they are willing to work with larger businesses. But their idea is they look beyond the benefits package to the design of the job itself. So they look at flexible work schedules, purpose in the job, purpose-driven jobs. They look at other things that may interest people beyond just benefits, and they will describe their strategy and work through an example at the end. But we have 2 people that have gone through it with them coming in. And For the HR professionals, I shared that we have a peer impact network. We also, if you want to continue these discussions after these 2 webinars, we offer an open space called Birds of a Feather. And our Birds of a Feather for October, after these 2 webinars, we know you'll have a lot of things to talk about, is called Human-Centered Workplaces. So we invite you to attend a lunch on Friday just to talk to other peers, and these are free and open to all. And we have other programs that you could sign up for that are peer-to-peer facilitated workshops that you can engage in cross-learning in as well. So I invite you to visit our website. Thank you for joining us. And thank you all for coming. Thank you to the Richards Group for always being willing to offer their services. It is wonderful to work with them. And we have also the mental health first aid training through them. So thank you all.
Yes. Have a good day, everybody. Thanks for being here.
Thank you.
Okay.